Most people think kidney disease announces itself. Swollen kidneys, pain in the back, something obvious enough to send you to the emergency room. That is not how it works. In reality, the kidneys can lose 50, 60, even 70% of their function before a single symptom becomes obvious enough to name. And by the time most patients over 60 are diagnosed, the damage has been building for years quietly, invisibly, in the background of an otherwise ordinary life. Here is what nobody tells you. In the year before a patient reaches end-stage kidney disease, 3 out of 4 of them will have had a cardiac event, not a kidney crisis, a heart attack, a stroke, an episode of dangerous arrhythmia, because the heart and the kidneys are not separate problems, they are the same problem. And when one starts to fail silently, the other is already paying the price. My name is Dr. James Harmon. I'm a cardiologist. I've spent 25 years watching the connection between kidney decline and cardiovascular collapse play out in patients who had no idea those two organs were even in conversation with each other. Today I'm going to give you 7 warning signs your kidneys are sending right now. Signs most doctors miss, most patients dismiss, and most people over 60 are walking around with as we speak. Before I give you the 7 signals, I need you to hear what happened to Dorothy. Dorothy was 68 years old, retired nurse, which is the part that still haunts me. A woman who spent 40 years reading other people's bodies for a living. She knew what a sick patient looked like, she just didn't recognize it in herself. It started small. She was tired in a way that felt different, not the pleasant tiredness of a long day, but a heaviness she couldn't shake no matter how long she slept. She assumed it was age. She noticed her ankles looked puffy in the evenings. She assumed it was the heat. She had a persistent itch across her back and shoulders at night that her dermatologist treated with a topical cream for 6 months. And she had been waking up 2-3 times a night to use the bathroom for almost 2 years, which everyone, including her own doctor, chalked up to a small bladder. 4 separate symptoms, 4 separate specialists, not one of them ordered a kidney function panel. Then Dorothy came to me, not for her kidneys, for palpitations. Her heart was racing irregularly at 3 in the morning. Waking her with a panic, she said, felt like being grabbed from inside the chest. When I looked at her full blood work, her creatinine was elevated. Her EGFR had dropped to 34, meaning her kidneys were functioning at barely a third of normal capacity. She had stage 3 chronic kidney disease, and the potassium imbalance that came with it was driving her arrhythmia directly. She looked at me and said, "How did I miss this?" And I told her the truth. You didn't miss it. The system missed it. The itch wasn't a skin problem. The puffiness wasn't the heat. The fatigue wasn't age. They were all the same message, coming from the same place, in the only language the kidneys have. Dorothy is stable today. Her cardiac arrhythmia is controlled. Her kidney disease, caught at stage 3, has been manageable. But she told me recently, "James, if I had come to you a year later, I don't think I would have made it." She was not wrong. Type your age in the comments right now and the number of times you wake up at night to use the bathroom. Just 2 pieces of information. You will be surprised how many people watching this right now have never once connected those nights to their kidneys. Signal 1. Fatigue that sleep does not fix. This is the most dismissed symptom in kidney decline, and the most dangerous precisely because of that. When your kidneys lose filtration capacity, waste products, creatinine, urea, uremic toxins begin to accumulate in the bloodstream. These substances are not neutral. They suppress the production of erythropoietin, a hormone your kidneys produce specifically to signal your bone marrow to make red blood cells. Less erythropoietin means fewer red blood cells. Fewer red blood cells means less oxygen delivered to every organ in the body, including your heart and brain. The result is a specific kind of fatigue that patients describe in remarkably consistent ways. Not sleepiness, heaviness, a feeling of operating through thick air. Mental work that used to be easy becomes laborious. Physical tasks require recovery time that feels disproportionate. A 2021 study published in the Clinical Journal of the American Society of Nephrology found that unexplained fatigue was present in 73% of patients, later confirmed to have moderate to advanced chronic kidney disease, and that in the majority of those cases, fatigue had been present for more than 18 months before any kidney function test was ordered. The fix is not rest. The fix is a blood test. If you have been tired for months in a way that doesn't lift with sleep, ask your doctor for a complete metabolic panel that includes creatinine, bun blood, urea, nitrogen, and a calculated EGFR. That test costs very little. It tells you almost everything. Signal 2. Swelling in the ankles, feet, or face, especially in the morning. Healthy kidneys regulate fluid. They are your body's drainage system, pulling excess water and sodium out of the bloodstream and directing them out through urine. When that filtration weakens, fluid doesn't exit the body efficiently. It pools, and it pools where gravity and tissue allow it: the ankles, the feet, the lower legs. In the morning, before the body has been upright for hours, it sometimes accumulates around the face and eyes. Here is what makes this signal deceptive. Fluid retention has many causes: heart failure, vein disease, certain medications including calcium channel blockers and some blood pressure drugs. That overlap is real. But here is what most patients don't understand. Kidney-related and cardiac-related fluid retention are not separate issues. In a condition called cardiorenal syndrome, declining kidney function worsens heart failure and declining cardiac output worsens kidney perfusion. They worsen each other in a feedback loop that accelerates rapidly once established. A 2022 paper in the European Heart Journal found that patients with both mild kidney dysfunction and mild heart failure deteriorated to advanced stages of both conditions on average 4.1 years faster than patients with either condition alone. That number should stop you cold if you press a finger firmly into the swollen skin above your ankle and release it. Look for a pit and indentation that stays for a few seconds before the skin slowly returns. That is called pitting edema, and it is a reason to call your doctor this week, not wait for your next scheduled appointment. Have you noticed swelling in your feet or ankles that comes and goes? Write yes or no in the comments. Signal 3. Changes in urination color, frequency. Foam. Your urine is a direct readout of your kidney function. Most people never look at it carefully. After 60, that is a mistake. Frequency. Kidneys losing their filtering ability often produce dilute urine in higher volumes, the body trying to flush toxins with less efficiency. Waking up 2 or more times a night to urinate is called nocturia, and while it is common in older adults, common is not the same as normal. A 2020 study from the Journal of the American Geriatric Society found nocturia in adults over 65 was significantly associated with reduced EG, for a kidney function marker, even in patients with no other apparent symptoms. Color. Dark amber or brown urine, especially in the morning, can indicate concentrated waste products the kidneys are struggling to dilute. Blood-tinged or pink urine, even if painless, is a reason to contact your doctor the same day. Foam. This is the one most people have never heard of and most doctors underemphasize. If your urine produces persistent bubbles or foam that takes more than 30 seconds to settle, that is a visual indicator of proteinuria, protein in the urine. Healthy kidneys do not allow significant protein to pass through their filters. When those filters are damaged, protein leaks. Foamy urine is, in many cases, the earliest visible sign of kidney filter damage. A 2023 review in Nature Reviews Nephrology confirmed that persistent proteinuria is one of the most reliable early biomarkers of progressive kidney disease and that it often appears years before creatinine levels rise noticeably. The next time you use the bathroom in the morning, pause for 10 seconds and look. Your kidneys have been trying to show you something. Signal 4. Persistent itch with no skin explanation. This one sent Dorothy to a dermatologist for 6 months when the answer was in her kidneys the entire time. When kidney filtration declines, phosphorus accumulates in the blood. Your kidneys are the primary regulator of phosphorus balance. As they weaken, phosphorus builds 2 levels that cause calcium phosphate crystals to deposit in skin tissue and stimulate nerve endings. The result is a deep, persistent itch, often across the back, shoulders, and arms that topical creams do almost nothing to relieve because it is not coming from the skin surface, it is coming from inside. The medical term is uremic pruritus, and according to a 2021 systematic review in the Journal of the American Academy of Dermatology, it affects an estimated 40% of patients with moderate to severe chronic kidney disease, and in a significant proportion of those patients, it was the presenting symptom that led to eventual diagnosis. Here is the distinguishing feature. Kidney-related itch is characteristically worse at night. It is not associated with a rash in most cases. It does not respond to antihistamines, and it has no obvious trigger: no new soap, no dietary change, nothing you can point to. If you have had an itch lasting more than 6 weeks on the back, shoulders, or arms that hasn't responded to standard treatment, ask your doctor to check your kidney function and your phosphorus levels before you try another cream. Signal 5. Metallic taste or ammonia breath. This is the signal most closely linked to the danger zone. Urea, a waste product your kidneys are designed to eliminate, is broken down in the mouth and digestive tract by bacteria into ammonia. In a body with healthy kidney function, urea is filtered before it reaches a level where this becomes noticeable. When filtration is severely compromised, urea accumulates in the bloodstream and saliva, producing a distinctive taste that patients describe as metallic, bitter, or chemical. Breath takes on an ammonia quality, sometimes described as smelling like urine. This symptom, called uremic fever, typically appears at more advanced stages of kidney disease. But here is why it matters even before it becomes obvious. The same accumulation of uremic toxins that causes this taste is simultaneously damaging the lining of blood vessels, suppressing immune function, and accelerating cardiovascular inflammation. A 2022 paper in the Journal of the American Heart Association found that elevated serum urea, the biochemical driver behind this symptom, was independently associated with a 42% increase in major adverse cardiac events in patients over 65. If food has been tasting consistently metallic or bitter and you cannot explain it, if your coffee tastes wrong, if your morning mouth has taken on a chemical quality, this is your kidneys speaking in the clearest terms they have. Do not mask it with mouthwash. Report it. Signal 6. High blood pressure that isn't responding to medication. This one is the most dangerous because it looks like a cardiovascular problem while being, at root, a kidney problem, and treating only the heart end while ignoring the kidney end is like bailing water from a boat with a hole still in the hull. Your kidneys regulate blood pressure through a hormonal system called the renin-angiotensin-aldosterone system (ROS). When the kidneys sense reduced blood flow, they release renin, which triggers a cascade that ultimately raises blood pressure to compensate. In a healthy body, this is a precise and self-correcting loop in a body with damaged kidney tissue. The kidneys chronically misread their own blood flow signals and keep the renin signal switched on. Blood pressure goes up, more pressure damages the kidney vessels further, which damages filtration further, which triggers more renin. Another feedback loop, this one between kidney disease and hypertension, that can cycle for years before anyone identifies it. A 2023 study from the European Journal of Preventive Cardiology found that treatment-resistant hypertension, defined as high blood pressure that doesn't adequately respond to 3 or more medications, had an underlying kidney function abnormality as a contributing factor in over 60% of patients over 60 years old. Over 60%. If you are taking 2 or more blood pressure medications and your pressure is still not well controlled, ask your doctor specifically, has my kidney function been evaluated as a contributing cause? Ask for an EGFR and a urine albumin to creatinine ratio. Those two numbers together give a far more complete picture of what your kidneys are actually doing than either alone. Signal 7. Muscle cramps and restless legs at night. This is the signal clearance a patient I discuss in other videos described as what finally broke him. Waking at 3 in the morning with cramps so severe he had to walk them off for 20 minutes before he could lie down again. When kidney function declines, the balance of electrolytes calcium, potassium, phosphorus, magnesium shifts in ways that directly affect muscle function. Specifically, low calcium and elevated phosphorus create a chemical environment in which muscle nerves become hyperexcitable. They fire too easily, too strongly, and at the wrong times. Restless leg syndrome, a persistent urge to move the legs that worsens at rest and is worst at night, has a confirmed association with kidney disease that was formalized in clinical guidelines over a decade ago but rarely mentioned in the conversation between primary care doctor and patient. A 2020 meta-analysis in Sleep Medicine Reviews found that adults with chronic kidney disease had a prevalence of restless legs syndrome 2.5 times higher than age-matched controls, and that in many of those patients, kidney disease had not yet been formally diagnosed. The distinction that matters: kidney-related cramps and restless legs are not simply low magnesium you can supplement your way out of without addressing the underlying cause. Supplementing electrolytes in kidney disease without medical supervision can be genuinely dangerous. The kidney's impaired ability to regulate potassium means that supplementation can push levels to cardiac risk territory. This is a reason to see your doctor, not a reason to reach for the supplement aisle. How many times a week do you wake up with leg cramps or restless legs? Type that number in the comments right now. Here is what I want you to understand about everything we have discussed. Your kidneys have no nerve endings inside them. They cannot produce pain the way a pulled muscle can, the way a cracked rib can. Pain is not a language they speak. So when they are struggling, they send their messages through everything else: your energy, your skin, your sleep, your blood pressure, your taste, your legs at 3 in the morning. 7 different signals, all saying the same thing, in the only languages available. The reason so many people over 60 miss this is not lack of intelligence. It is that each signal in isolation sounds like something ordinary: tired. You're 68, swollen ankles. Must be the heat, waking up at night? Older bladder. When you see them together, the picture changes entirely. Your kidneys have been quietly protecting your heart your entire life, filtering approximately 200 liters of blood every single day without ever asking for acknowledgement. The least you can do is learn to listen when they finally ask for help. Before your next doctor's appointment, write these down. The 5 tests to ask for. Egg for estimated glomerular filtration rate. This is the single most important number for kidney function. Serum creatinine and BUN. Urine albumin to creatinine ratio detects protein leaking through damaged kidney filters. Serum phosphorus and potassium, especially if you have any of the muscular symptoms we discussed. A complete blood count to check for the anemia that accompanies declining erythropoietin production. The exact words to use with your doctor. I've been experiencing. List your symptoms. I'd like to discuss whether a kidney function screening is appropriate, including an EGFR and urine albumin to creatinine ratio. If any of these are emergency level warnings, go today, not next week. Blood in the urine, sudden severe swelling of the face, hands, or feet, significantly reduced urine output combined with fatigue and confusion, muscle weakness with irregular heartbeat. Don't try all 7 signals at once. Pick the 1 or 2 that resonated most. Write them down before you close this video. One piece of information brought to one appointment can change the entire trajectory. Which of these 7 signals do you recognize in yourself or someone you love? Tell me in the comments. I read every single one. And there is someone in your life, a spouse, a sibling, a friend over 60 who has been blaming their fatigue on age and their swollen ankles on the weather, who has never once heard the word EGFR. Share this with them. That one share could be the conversation that catches something before it can't be caught. If you haven't subscribed, please do. Every week I bring you honest, evidence-based information I wish every patient had access to long before they needed a cardiologist. Take care of your kidneys, and in doing so, take care of your heart. The two have been working together on your behalf every minute of your life. They deserve the same effort in return. Everything I've shared today is general medical information based on published research and my clinical experience. It is not a replacement for your personal medical care. Every person's situation is unique. Please do not stop or adjust any medication without speaking to your own doctor first. Bring these questions to your next appointment. Your doctor is your partner in this, and an informed patient is a better partner.